I'm Cassandra, and I work with ThedaCare. I'm also a busy mom of 3. Doing it all is more challenging than ever, and that includes making healthcare decisions. So, welcome to Real Talk, where we cut through the confusion, chat with experts, and help you get the care you need for you and your family. Whether you're an avid gardener, a marathon runner, or a busy parent on the go, pain and injury can slow you down. Sports medicine physicians can treat a variety of conditions and injuries. And here to talk through all the aspects of care is Dr. Ryan Wagner, a sports medicine physician with ThedaCare. Welcome, Dr. Wagner. Thanks for being with us. So first question, people might not really understand what sports medicine really is. So can you kind of give us a breakdown?
Yeah, so sports medicine is a wide range of different treatments as well as injuries. So we see a wide variety of people in the clinic. It ranges from infants all the way up to the geriatric athlete or person in general. We see kind of that weekend warrior all the way up to elite athletes as well, high school kids in between, obviously. But I think kind of the misnomer with sports medicine is that everybody thinks that it has to be a sports injury for us to see it in clinic, and really that's not the case. We see a lot of varying presentations, so whether your knee has hurt for many years, we'll see you, or anything from a fracture to a concussion. So we see a wide variety of presentations in the clinic.
I like what you said about that because, right, when you think sports medicine, you think an athlete and an injury, but that's not just the case there. So how do people know if a sports medicine physician is the right provider for them?
In sports medicine, we have a lot of different treatment options to be able to help you get back onto the field, whether it be getting back onto the court or just back into if you just like to play sports on the weekends with your grandkids. Many different things that we have to offer. So anything from physical therapy to occupational therapy to bracing, and then we do a lot of injections as well. So whether it be steroid injections or those gel shots, viscosupplementation injections, we do quite a bit of as well. One other treatment option that we can also provide is platelet-rich plasma, which is PRP. So that has also been used in the clinic as well.
Sports medicine physicians, how do they work with other providers to make sure that all of that care is comprehensive?
Yeah, so especially at the OSP here, we have a lot of different providers, as you mentioned. So we work closely with the pain team. So we send a lot of patients back and forth because a lot of the presentations we see overlap with each other. And then we also work very closely with both the total joint replacement surgeons as well as the sports surgeons. So whether it be a sports injury that we kind of send down to Dr. Erickson that you've talked to before, or Dr. Liebelt for total joint replacements. So we work back and forth, and it's been a great partnership to be able to communicate in one single location.
That really is one of the benefits of this location. It's all the care you would really need under one roof, and it makes it really easy for the patient.
Yeah.
All right.
That's great.
Wonderful,
That's
Dr.
great.
Wagner. Let's get to know Dr. Wagner a little better with some candid questions. First question, what's the biggest piece of advice you would give young athletes and their parents?
I always like to quote from Vince Lombardi. So it's not whether you get knocked down, it's whether you get back up. And I think that kind of plays into, especially the young athlete, because along the road, there's going to be a lot of ups and downs. So whether it be an injury or whether it be wins and losses, there's going to be things that at times you don't feel great about. But I think the biggest point is that you get back up and you keep going after it and keep going after your goals. As a parent, I think one of the things you want to really encourage kids to do is doing what they enjoy. Not pushing them into doing a particular sport or hobby, really letting them find themselves and exploring it on their own.
What is it like to work with area high school sports teams?
Oh, it's great. I enjoy it. I'm one of the team physicians for Fox Valley Lutheran, so we get to go onto the football field and cover the high school football games, which is always a great experience. And then really working with not only the athletes, but also the athletic trainers from the school as well. And so I'll spend some time seeing young high school athletes both in the clinic, and then at times I will also go to the training room as well. So it's a great relationship to develop.
What's the most gratifying part about your work?
The most gratifying part about my work is definitely seeing patients get better, getting to see them get back out onto the playing field, or helping people feel better and optimize their return to doing what they want to do in life.
You grew up in Appleton, in the area here. So what are your favorite aspects about this community?
My parents still live here. I have family here, and so it's always felt like home. It's a great community environment, and one of the great aspects about working at ThedaCare is being able to come back and help to treat my community and the people that live in it.
You worked with various teams and different organizations like the Milwaukee Bucks, Milwaukee Brewers, Milwaukee Ballet. What were those experiences like?
I worked with them during fellowship, and it was a great opportunity to not only get to work with athletes on a very high level, but also the medical staff. So being able to be, part of the team behind the team, even kind of translating that to back home here. So I'm one of the team physicians for the Wisconsin Timber Rattlers and the Wisconsin Herd. So being able to not only keep those players healthy and on the field, but also being able to develop a relationship with those players and really, getting to know them both as a person, both on and off the field has been very rewarding.
As we've discussed, there are some misconceptions around sports medicine, so we're going to play a round of myth versus fact to get a little bit more information. So the first one that we have is stretching prevents injury.
Yeah, I think this is fact and both myth. There's different types of stretching, and that's why I kind of answered both ways. So static stretching is kind of that traditional stretching, and it's been shown, there's been research that's shown that doesn't necessarily help with preventing injury. But there is dynamic stretching, which is kind of stretching while you're moving, and that has been shown to reduce some injuries prior to performance.
Absolutely, things to remember. Okay, next one here. Good idea to take an anti-inflammatory medication before exercising.
Yeah, I think this can be both fact as well as myth. I sometimes recommend doing anti-inflammatory before, activities. It can sometimes help with pain control, but there's definitely research out there that shows that if you take an anti-inflammatory, after, working out, it kind of decreases that inflammatory process, which is part of the healing process. So it can kind of inhibit that healing process that we want to try to avoid inhibiting.
Okay. Next one. Best to have kids participate in multiple sports, not just specializing in one.
Fact. Yeah. Ideally, we want athletes to be well-rounded and participate in multiple different sports. It can help with muscular development and just performance in general, and it can decrease overuse injuries as well.
And it gives kids that opportunity to figure out what they love.
That's exactly right.
Okay,
yeah.
Great. Okay, next one. Longer workouts will bring the greatest benefit.
Myth. Working out longer is not necessarily always the smarter way to work out. So, being in the gym for 4 hours lifting weights or on the treadmill for, multiple hours is always not ideal. Once again, being well-rounded. So mixing in, weights as well as cardio can once again decrease overuse injuries and can lead to you overall being able to stay out on the court or the practice field and optimizing your ability.
All right, there you have it. Myth versus fact. The internet offers no shortage of entertainment and education. Dr. Wagner, let's get your take on a couple of videos. And we do want to note this should not replace a medical diagnosis or advice.
All right, let's take a look at the first one.
57% of Tommy John surgeries are performed on teens aged 15 to 19, only 25% on older Major League Baseball pitchers, according to a 2015 study in the American Journal of Sports Medicine.
Yeah, I think this clip is very interesting. I think it relates back to the idea of sports specialization, where young athletes tend to engage in sports year-round. So whether it be playing for their high school team followed by a club season that allows them to play 12 months out of the year. And this really precludes to overuse injuries as well as injuries in general. And so, our recommendation is, taking time off during the year as well as playing multiple different sports to really get a diversified, well-rounded approach to sports and health in general.
I get it. You could have a star receiver that's a game changer, get rocked, and you're like, hey man, you okay? Get back in the game. But at the same time, if that's your boy, if that's your brother, hey man, go get looked at real quick.
Yeah, this is another great video. And this video discusses concussion. And concussion is a very high yield topic in sports medicine these days. And one of the things that I would really like to emphasize on concussion is that not only does it happen, during football or hockey, during some of more of the full contact activities, but it can also happen in any sport. It doesn't have to necessarily be a full contact sport. And so really watching for those signs of concussion. So headache, fogginess, blurred vision, sensitivity to light and noise. And I think the biggest thing is if you take a blow to the head, to really recognize those symptoms and say, hey, coach, I'm out. I need to be looked at and not stay in the game, because that's when we see a lot of the more serious aspects and consequences of concussion happen, is when players continue to stay in the game. Let's take a look at one more video.
Choke up on the bat, baby. Oh, come on, Avery.
Choke up. You got it, Avery.
Choke up on the bat, Avery. Look at right. That is so sweet.
There you go, buddy. There you go. Swing fast.
That is so sweet.
That's great. That's a very heartwarming video. My initial reaction to this is I think it's about sportsmanship and everybody kind of helping each other out, whether it be at the youth level all the way to the professional level. Sportsmanship is one of those aspects of sport in general that everybody should practice. And you may be on opposing teams, but being able to help another person out to help them achieve their goal, I think is very rewarding, and it can make you not only a better athlete, but a better person in general.
Dr. Wagner, thanks so much for being with us today and introducing us to the world of sports medicine. We very much appreciate it. And if pain is getting in your way, feel free to call and schedule an appointment with ThedaCare Orthopedic Care. Walk-in care is also available. We'll see you next time on Health Inspired Real Talk.
At ThedaCare, our mission is to help you live your unique best life. And we want to know what kind of questions you have when it comes to your health care. Leave your questions and comments below. And be sure to like and subscribe so you see the very latest in this series.